Hi, today I'd like to talk about bacterial versus viral pharyngitis and why. Because I find this topic was very confusing, and I always try to find a solution of before we get the results of the blood culture or the throat swab. Is there really a way for us to tell is this if there's a bacterial or viral infection? So I gained some experience from the clinic, although they are not like a very like there's no common agreement of it, and it's also my own experience, but I find them helpful, and I like to share with you guys. And if you guys also have you other very good experience or point, feel free to leave in the comment section and help us all to get through this difficult topic. So as usual, I like to start with a case. In case one here, we have an 8-year-old boy present to the emergency department with severe throat pain and fever for 1 day. The patient was unable to eat solid food because of the pain. Our physical examinations revealed there's a cervical lymphadenopathy, swollen uvea, and palatal petechiae were noticed. Let's see what are the key points in this case. So we have a 8-year boy, and then severe throat pain and fever for 1 day. So the time tells us it might be a sudden onset of fever together with throat pain, and then the patient was unable to eat solid food. That means that is dysphagia. And from the observation we find here, and then the cervical lymphadenopathy. So in this moment, let's leave the diagnosis behind and let's move to case two first. And case two, we have another 6-year-old girl present to the emergency department with 3-day history of fever, throat pain, cough, difficulty in swallowing, and hoarseness. Our physical examination involved fatigue, dehydration, severe throat congestion, and enlarged tonsil with white tonsil exudate, and there's also anterior and posterior cervical lymph nodes enlargement is here. And then also like the previous boy, this girl also present palatal petechiae, and then the uvea is a bit swollen, and most distinguished thing is that we find mild splenomegaly and hepatomegaly. So let's talk about this. Also talk about the keywords of this case. That is the 3-day history of fever, and then with other symptoms. So whenever you find there's a hoarseness in the children, make sure before you wanna check on his throat, make sure to exclude that it's not an epiglottitis, epiglottis. So because that is very dangerous infections. So uh, in this, if it is really epiglottitis, we shouldn't perform any procedure that will that have to like touch the throat of the child, or it may cause like difficult of breathing, and then worst the worst case is death. So if this really this case, we have to order a neck chest a neck X-ray instead. So that's a bit far from the case here. So let's back to the case, but always be careful. And then this child also have a dehydration. It is common because there's a dysphagia and the child will just avoid drinking. So it's normal to be dehydrated. And a severe food congestion and large tonsil with white patches here, and then enlarged lymph node. And then these symptoms all point to the EBV or infectious mononucleosis, and which is a viral pharyngitis. And the previous case, this is a group A streptococcus infection. Why I choose these two as the case study, because these two infection are the two we have most important pathogen, bacteria and virus we have to diagnose and treat them in the clinic. And why are they important? I will talk about them in detail. But first, I have a table here. Try to list the distinguish the specific characteristics, the symptoms. But please remember that they are not absolute, and in many cases, the viral or bacterial pharyngitis, they have overlapped the symptoms. So this is just for you to have a clue. And I have an extra column for group A streptococcus because it's, like I mentioned before, it's very important for you to diagnose this infection. So I put in the individual column. So let's look at the first one, the bacterial infection first. So why I emphasize on the sudden onset of fever in case 1, which is a 1-day fever, because one of the characteristics of bacterial pharyngitis is a sudden onset of fever, sulfur, and dysphagia. And then what interesting is there's absence of cough in bacterial pharyngitis, and there is coughing in viral infection. So just like in case 2 here, there's coughing, and then there's no coughing in the case 1. And although I put cervical encephalopathy in bacterial infection, but just like case 2 EBV, we there's also lymph node enlargement. So this is one of the example of there might be overlap of symptoms, but still I put it in this table. And then these three are they are all very common symptoms in pharyngitis, and this might not only be appear in bacterial but also in viral pharyngitis. Unfortunately, you cannot by just look at and oh, there's white patches, and there must be group A streptococcus. Yes, this is true, but sometimes EBV looks similar. So yeah, it's still very difficult for you by just looking at the throat and make a diagnosis. So there's also other symptoms just for your references. And our important guest, the group A streptococcus here, I'm not gonna talk about them one by one. So I know it's difficult for you to memorize. So, but please try to memorize or do more case study or questions. At least I memorized them in the pediatric outpatient clinic, so there's no problem for me. But so this is one of the method you can memorize. So if you have the chance, just stay in the outpatient clinic, especially in the winter or early spring, then there are a lot of examples for you to observe. I just memorized them in a week, so I mean just by looking. I didn't even try, so it's just go to the clinic. This is a very good way to learn. And why is it important to identify group-based streptococcus infection? Because if you leave them untreated, they will become like progress into post-streptococcal glomerulonephritis or rheumatic fever. These two are all very like annoying disease and causing a great damage to the patients. So please make sure you give antibiotics immediately once you identify there's a group-based strep. And this too, and why I also said it's important for you to identify this EBV infection, and this is why. If you miss diagnosis of the patient of there's a group-based strep infection and you gave penicillin to the patient, that will trigger a hypersensitivity reaction and causes rashes here, like in this picture. And yeah, but at the same time, the image to the left, that is actually a rash from scarlet fever that is by group A thread infection. So they actually look like very similar. That's why I didn't point out what the image what this image is in this slide, because they look very similar. So at the end of the day, you cannot just rely on one point and one specific symptoms try to identify what is the infection. Just like in here, EBV infection, you have to check on the history of the patient, like, oh, you got an infection last week and you got some medicine, and what is that? Oh, penicillin, and then you know this is a EBV. This amoxicillin-induced rash secondary to EBV infections. And this one here, there's a scarlet fever rash here. What interesting is there's no rash. There's a spare of rash on the palm, and this is the way you can identify this a group A strep infection. At least I find this very interesting. And we have, sorry, I try to point out what are the common bacterial pharyngitis and try to list what are their characteristics. But like, unfortunately, you can already see like patches, great white patches, tonsillar pharyngitis, or bronchitis. They are all very common symptoms. So but some they are quite specific, like here that there will be a white membrane on the tonsil or pharyngeal surface, and this is like this. When you see this, you must, it must trigger your alert, because this, if you leave it untreated, could be fatal. So you have to give I think that is you have to give antibiotics immediately. But I think this is not as common in modern days now because we have vaccinations. So, but still, there's there may be some parents, they have their own opinion on vaccinations, and so they choose to not give their child vaccine. So you also have to look at the vaccination record. And once you identify this, you have to isolate the patient and give penicillin or erythromycin. And these are the only two agents recommend for the treatment of the diphtheria. And yeah, others are, I find that is especially like very specific, and this one. This is the complication. This is not the symptoms of this infection, but they are the complication of this infection. So especially this syndrome. I find it's also very specific. But at the end of the day, it is very difficult for you by just looking at the symptom and distinguish this which pathogen, and is it impossible. So just make sure you send the samples if you have a blood culture or swab flow, etc. And also here, this the list of what are the common virus that cause viral pharyngitis, and you may see like many of them were like there's just common cold, or or lymphadenopathy. So just like what I meant, just like what I said in the previous slide, this is very hard by just looking at the symptoms. One of the thing just have left give me a very strong memory, because I've seen many child with hand foot mouth disease and herpesgia, and so it's very easy for you to distinguish them. Just like hand foot mouth disease, as the name mentioned, there's rashes on the hand, foot, and mouth. And what makes herpesgia different is there's only rash in the mouth, but they're caused by the same type of virus. And I find this very interesting, so I share this with you here. And we have a table of laboratory tests here for the bacterial and viral pharyngitis. Yeah, you can order them once you have a clue. And what I like to explain is the extra column extra row I add here through breadcrumbs. Like this is not a specific and or helpful test for you to identify what is the infection, which type of the infection is. But I find it interesting. I'd like to share with you. So, from what the observation I find in the clinic, I find that if there's and this is not only me find that there's also some article mentioned about it, but still they are not an absolute references, but just a quick share of you. So if there's a bacterial pharyngitis of like there's of course there's gonna be an increase of the white blood cell count. I don't even have to explain it. But if there's a viral pharyngitis, the white blood cell counts can be normal or lower white blood cell count. So usually I find the white blood cell count is normal in viral pharyngitis. But in other cases, like very severe infections, viral infection, the white blood count may increase too. But commonly, like those kids, they have a common cold and come to clinic and order like a blood test for them. And usually I find that the white blood cell count, they are normal. So that's a very interesting finding, and this might help. I hope this might help you because like you don't want to just give penicillin to everyone, to every kids, and then trigger the hypersensitivity infection if there's a EBV. So yeah. And but anyway, so if there's a very severe infection, no doubt the white blood count will be lower. And we have a scoring table here. You can stop here and have a screenshot, and you can also find from the internet. So the criteria here is basically the typical symptoms of group A strep. So just keep the score according to each criteria, and here already tell you what to do, when to give antibiotics, and then should or shouldn't you give antibiotics. And here also you give like just always give some amoxicillin or penicillin G, but always check if the patient have any, is there any allergy. And yeah, and here is also a table of quick quick demonstration of those common bacterial pharyngitis pathogen, and then what are the management of them. And here is for the virus. You can find most of them are supportive. What means supportive? Like if the patient have a very high fever and in huge pain, then you just give them uh, paracetamol or ibuprofen, or if this patient is in dehydration, just give them saline if needed, and etc. So even though my video is like I try to help you to distinguish the bacterial and viral pharyngitis, like at the stage of like physical examinations, unfortunately, no, because like in the real situation, there's always overlap the symptom, just like the case 1 and case 2, they both have enlarged cervical lymph node, and they both have exudative pharyngitis, etc. But it doesn't mean that those characteristics we learned in the previous slides are useless. They just help you to have a clear idea, like from like ideas to help you to make a quick, especially during a quick decision. So although they are not an absolute guide for you to make a diagnosis, but they give you a picture. So I hope it helps. And thank you so much for listening, and see you next time.